anybody joins in a little while, that's fine. We've got the recording, they can always catch up. So welcome to everyone who's made it here today on time. I'm not Patrick, obviously. I'm Angel. I'm the Business Development Manager for Medical Aesthetics Group. And today we've got a wonderful webinar on RadiaNt fillers. Debbie Battat from DCL will be heading it up for us and talking about the company and the products and the amazing technology behind the RadiaNt fillers. And then we've also got Rue here. Rue is our trainer and we'll be talking about the training that we'll be offering as well alongside the fillers. So if you've got any questions during the webinar, please feel free to put the questions into the chat box. And when Debbie's finished, we'll go through all of the questions and answer them for you. And if you can all just mute yourselves, if possible, that'd be great. And Debbie and Rue, if you just want to introduce yourselves so everybody knows who you are.
Sure. Rue, why don't you go ahead?
I was just going to go, Debbie, why don't you go ahead?
You should do it.
Hi everybody, I'm Rue. I am based up in Scotland, but I am going to be covering the whole of the UK for the time being. Unfortunately, one of our other trainers at the moment is just out of action for a little while, so it'll be my face you'll be seeing travelling around. So I work very closely and also use this filler myself in clinic. Absolutely love it, get amazing results. So I was glad Debbie introduced me to it and has spent time educating me on the filler and how to use it. So I'm very excited for everybody on the webinar to learn about it and hopefully use it in their clinic as well. And hopefully we'll see you on a training day. Over to you, Debbie.
Thank you. So hi, everybody. My name is Debbie Battat. I'm actually from the commercial side. I work with Dr. Korman now for about 1.5 years, but I have a long history in aesthetic medicine, both surgical and non-surgical. So currently I'm the head of clinical education for Dr. Korman Laboratories, which is the manufacturer of RadiaNt. And I also take care of business development in Europe, Middle East, and Africa. We not long ago launched in the UK, so I'm very glad that you can be here so we can introduce you to the company. And prior to this, I was for many, many years in Johnson & Johnson and also in professional education as well. And Angel, would you like for me to go ahead and get started with the presentation, or would you like to say another few words?
No, I think that's great. If we get started, Debbie, and then if anybody else joins, I'll fill them in the chat to ask questions and stuff in the chat.
Okay, wonderful.
Thanks, Debbie.
All right. So I'm going to go ahead and share my screen, and that's what we want. All right. Okay, great. Everybody can see, or if somebody can just let me know that they can see.
Yes, all can see.
Wonderful. Okay. So the purpose of this is just to give you a little bit of a background of Dr. Korman Laboratories, of the RadiaNt brand, and to go into some detail about our technology, because there are a lot of filler companies out there. There's some very good brands, and I think it's important that you understand where we are in this landscape, in this industry of aesthetic medicine. So first of all, I want to talk a little bit about the history of the company, how long we've been around, and what is our mission and vision and philosophy. So the company itself is from 2009. Our very first beginning was actually in mesotherapy, and then we quickly went into being a company that manufactures and produces hyaluronic acid dermal fillers. So shortly after that, you know, in the beginning, it started actually as a private label company for some really big markets. And based on the outstanding feedback from the doctors and from the practitioners, we then created the brand into the RadiaNt brand. So the actual recipe of the HA dermal filler is almost exactly the same. We've made some improvements in the delivery system and so forth, but the brand is fairly new in the aesthetic market. That being said, again, it's around since 2009 as an actual dermal filler. And since it's been around, we've had over millions of procedures in over 60 countries around the world. This is a little bit about our footprint. As you can see, we are basically everywhere except for North America, not yet in North America, but we're in Europe, all over Europe. Latin America, we have a very strong presence. And Asia, we're growing specifically in the last year or so, we're growing very quickly as well in the Middle East and also the Far East. A little just about the company. We are a lean organization, but that being said, we have a global presence. So myself, and the leadership of the company, we are most of us sitting in Israel, along with the manufacturing facility. So the medical director is very close to the manufacturing facility, the quality assurance to research and development, everything is very carefully monitored. And I would say that our excellence in manufacturing and our investment in the process of manufacturing is probably our key point and what we aspire to have in a really high standard and a world-class level. And that being said, we also have part of our team, our marketing director sitting in Sweden. We have a team in Mexico and in Canada, and the team in Mexico is managing Latin America. We do all of our testing in-house. So this is important to know, because if we ever want to make any comparative testing with any other products to test, for example, the degradation rates, the rheology, if we want to see, for example, how it's going with Belotera or Juvederm or any other product. So we can do comparative testing in our own facility, and we do all the other quality testing as well. And this is very important, because if there are any, if complaints do come in, which we do not see very much, however, it is a medical company, so we always need to be prepared for that. So we have a very strict protocol in terms of handling complaints, and we do all of the testing in-house to make sure that if any corrective measures need to be taken, so we can take them immediately. This is our certification. And this is our product lines that we have. Now, the product that is available in the UK for the moment, it is RadiaNt, which is the part on the right. These are our cross-linked and non-cross-linked dermal fillers. That being said, we also do manufacture still the mesotherapy, and we'll be launching soon the Salure, which is on the left side, which is our original formula, but with a branded name. And then the calcium hydroxyapatite. This one is without the CE certification for the moment. We will be going through clinical studies to launch this. However, it will take time, and it's not yet on the market. But this is a fantastic product. It's doing very well, for example, in Latin America. And if anybody would like some more information about the calcium hydroxyapatite, I'd be happy to share. But the purpose of this is really to focus on the RadiaNt brand itself. So as I said before, the manufacturing facility, I don't know if I actually mentioned it, so it's based in northern Israel. And it was born from the philosophy of our medical director, Svetlana Korman, who felt that the premium quality brands are simply out of reach for most of the patients, the premium quality dermal fillers. So this was kind of her, raison d'etre, that she wanted to create a product that would be more accessible to a wider number of people. And that's how RadiaNt was born, from the philosophy that everyone has a right to be radiant and look and feel their best. So this is our mission statement, that we aim to change the landscape of medicine, of aesthetic medicine, by making a premium brand that is available to everyone, everywhere. Let's go now into our line. But before that, I just want to give a brief summary about the rheological properties that we can see. Now, this is a very erudite audience, so I'm sure that you're perfectly aware about all of these, but I'll just mention very quickly. First of all, when we talk about rheology, we talk generally about three different parameters. The first one is the G prime, or the elastic modulus, which talks about the ability of the product to rebound to its original shape when acted upon by dynamic forces. The higher the elastic modulus, the firmer the gel. So this is great for more concentrated gels that you want to use for contoured parts of the face. The tan delta is then talking about the proportion of the elastic to viscous moduli. And for example, when something is more elastic, like gelatin, if it's more viscous, like honey, or you can have something that is less viscous, like water. So this is also talking about the parameter of the product itself as well. And then finally, of course, we have the extrusion force, which is just ensuring that there's a user-friendly and smooth experience for the practitioner when they are injecting and treating their patient. So the SKUs that we have in the UK market, it's RadiaNt Soft, Derm, and Ultra. The soft is the one that is with 20 milligrams of HA. This is used for the more delicate areas, can be used very nicely in the lips, also the tear troughs. We're currently also going through a rigorous clinical study right now. The study will take 1 year because we want to assess, first of all, the performance after 2 months, and then we want to ensure that there's safety measures. So this is going to be done for a full year. So we have a study coming up, and then we have the RadiaNt Derm, which is 23 milligrams of HA. And this is for a little more symmetry, a correction of symmetry, can be great for nasolabial folds. We have a study that was done on RadiaNt Derm, and I'll talk about it in a moment. It's also great for volume loss. It can be good in the chin and the cheeks. Can also be used in the lips for those patients who want a more bold and less subtle look as well. So people are using that in the lips as well. And then finally, we have our probably most popular SKU, which is RadiaNt Ultra. And RadiaNt Ultra is the 26 milligrams. And this is really great, especially, for example, in the mid-face and creating really those powerful contours where you want them, but still achieves a rather natural result according to the feedback from our patients and from our doctors. So this is the line. The RadiaNt Finesse is the 12 milligrams. It is available with lidocaine, but not yet. We had this previously with the CE certification, but at the moment we are focusing on these 3 lines here. Okay, so for anybody that's interested, these are the rheological properties of the Ultra, Derm, and Soft. Probably it's most similar in its rheological properties according to our in-house data. It's most similar to Juvederm. However, it's very important to note that while the rheology is similar to Juvederm, the technology is very different. And we're going to talk about the technology a little bit later. We don't have anything similar to the Vicross technology, but in terms of, let's say, the ability to sculpt and mold, it's similar in that rheological characteristics to the Juvederm products. All right, and of course we have the non-cross-linked HA, our biorevitalization product, very popular. This is designed more for the moisturizing the skin. It's for skin quality, which we can all agree is equally important as it is to sculpt and contour the face. It is 9 milligrams. It comes in a syringe form. And I believe that also this is actually has great results and great feedback in the UK specifically, actually. Okay, I want now to talk a little bit about the gel technology, and so that you can understand, how we are how the gel is structured, what are some of the key characteristics about it. So before I get into that, I just want to talk a little bit about where the gel is coming from and so forth. So most of the, let's say 2 or 3 of the largest global providers, or the largest global providers, are getting their raw materials from 2 or 3 companies in France. One of them is HTL. HTL is where Dr. Korman gets its HA gel from. But it's very important to understand before that, it's not that we all get the same HA gel raw material. We get the gel according to our specifications. So you're now going to understand a little bit more about those specifications, the molecular structure, and what impact that then has on the patient and on the safety and on the performance, and also on the user friendliness for the practitioner who's doing it. So if you cannot hear or see this film, just let me know. And okay, here we are, bear with me. All right.
Quality takes time. For RadiaNt dermal fillers, this means taking extreme care in ensuring the safety, longevity, and predictable outcomes of our products. It's a highly controlled proprietary processing technology known as slow HA. The process starts with high molecular weight hyaluronic acid in the form of long HA chains. Preserving these long chains is a vital part of RadiaNt technology. The long HA chains in optimal concentration are cross-linked and processed slowly at a constant native temperature. Processing at a lower temperature takes time, but it enhances the strength of molecular bonds through the wrapping of chains, resulting in the formation of high-density, low-porosity structure that is more resistant to diffusion and therefore to degradation. The gel's minimized water uptake leads to optimal post-injection swelling factor, ensuring consistent, reproducible results. The gel then undergoes a thorough purification process, leaving a high-purity, high-quality HA gel. The result is a versatile line of RadiaNt dermal fillers with an optimal balance between elasticity and viscosity. Covering a wide range of patient needs, they combine substantial lifting capacity with sufficiently soft consistency for ease of application. All thanks to our slow HA technology designed for safety, longevity, and radiant outcomes. Why slow HA? Because quality takes time, and everyone has a right to be radiant.
Okay, so I hope that this helped you to understand a little bit. I'm going to just highlight once more the key points. So basically, we get the gel according to specifications, and we are using predominantly long HA chains. So these long HA chains are then processed at a lower temperature. The benefit of doing it at a lower temperature is that you maintain the integrity of the structure of the chains. The lower the temperature, the better. We would do it even lower if we could, but actually the reason that companies generally do it at a higher temperature is obviously it takes less time. So if you have already just the production part without sterilization and packaging can take already several weeks, so you have a very, very long turnover for the manufacturing process. And we stretch it out as long as we can because we believe that it's the quality and the manufacturing that is, at the end of the day, the most important thing that we can provide our patients and for the doctors. So we have this low temperature, we have a longer duration of processing time. And then we have also what's called a swelling factor, an optimal swelling factor. And how does this contribute to the safety of the product? Well, the swelling factor is really about the ability of something to retain water. So for example, when the patient is leaving the procedure and she or he has a greater effect than will be after 24 hours, if you have too high of a swelling factor, it can mean that there could be edema or other adverse events because of that. So what you really want is to have something called an optimal swelling factor to achieve consistent results, and that there's not too much difference between when the patient leaves and then 1 or 2 days later. And of course, we have a high purity of the gel at less than 0.05 ppm of residual BDDE, which is far lower than the global standard. Okay, the final part I'd like to share is our recent clinical studies. And I'm just going to highlight the most important parts of it and what were some of the most important results. These have also been made into scientific posters, and I'm happy to share them with anybody who wants them. And it's also been published, and I'll talk about that in a moment. So first of all, we finished 2 clinical studies, and we finished at the end of the COVID, let's say 2022, they were finished. The studies were on 2 of our SKUs. First of all, RadiaNt Derm for the improvement of nasolabial folds. And the second one was to study the safety and performance of RadiaNt Ultra in mid-face augmentation. So a little bit about this. This was a split face intra-individual comparative study. And we compared RadiaNt Derm with Juvederm Volift in a single individual, and RadiaNt Ultra with Juvederm Voluma in a single individual. When I say single, I mean the split face comparison. A little bit more about that. 38 patients was what was needed to have, let's say, confidence in the in statistical outcomes, but we had 48 subjects just to be sure that we had the proper compliance. It was randomized and double-blinded, and the studies were performed by a reputable clinical research organization in Sweden. So that's just a little bit about the background. We also studied, what's important to say, what we used. In the nasolabial folds, we used the WSRS scale, and in the midface, we used Medici's midface scale. So these are the 2, let's say, most scientific and reproducible scales for maximum objectivity in evaluating the results. The publication for RadiaNt Derm was published recently in the summer, in the late summer, in the Aesthetic Surgery Journal. So we can send the link to anybody who's interested. And I want to show you the key highlights. So let's first look at RadiaNt Derm compared to Juvederm Volift. It was a 9-month study. So the light blue line is RadiaNt Derm, or DKL23, the scientific name. The dark blue line is Juvederm Volift. And we can see that there's no statistically significant difference at any time point, especially 6 months and 9 months. And what's also important to note is that the improvement was maintained throughout the study. So what we're really looking for is that the end point is going to be lower than the starting point. 4 means that there's very severe nasolabial folds, and 0 means almost absent. So we chose patients in between 3 and 4 because we wanted to ensure that there'd be enough visible nasolabial fold appearance that treatment would be good, but not too much that a treatment alone wouldn't suffice to make the desirable difference. So we can see that the positive results were maintained, no statistically significant difference between the 2, especially at 6 and 9 months. And there was a strong level of evidence as indicated by the low p-value here. It should be less than 0.01, and we had 0.001. Now we look at the results of the mid-face augmentation with RadiaNt Ultra vis-a-vis Juvederm Voluma. And we can see also that immediately after, and as you can imagine, within the first 2 months, significant improvement in the results. We chose patients, again, between 3 and 4 that had significant hollowing of the face, between moderate and significant hollowing of the mid-face. But again, we can see that the positive results were maintained throughout the whole 9 months, and that there's no statistically significant difference between these 2 products at any time point, including the key time points of 6 and 9 months. Where I do think it's very interesting to note, it's in the recommendation rate, and this is, again, this is from the clinical study. So these are, as much as I'd like to say that, this is from asking people and having great outcomes, the most important is to have scientific and reliable data to back up your claims. So one of the questions asked and the parameters tested was the recommendation rate as well as the satisfaction rate. And quite bluntly, they said, what is the likelihood that you would recommend this product to family and friends? So the participants responded for RadiaNt Derm in nasolabial folds. Both had the same for very likely, but where we had the delta, it was in the quite likely parameter. So overall, there was a higher likelihood to recommend RadiaNt to friends and family versus Juvederm. And the same was as well with RadiaNt Ultra. Here, actually, we did have a little bit of a delta versus Voluma, and also in the quite likely area. So overall, we had a better result in the likelihood of recommendation, which kind of makes us understand also why RadiaNt Ultra is one of our key selling products globally. And of course, the most important thing, it's the safety profile. So this, we measured all of the potential adverse, serious adverse and regular adverse and expected post-treatment events. First of all, it's important to say that there were no treatment-related serious adverse events that led to the withdrawal from the study at any time during the study. Most of the subjects experienced local tolerability symptoms with both of the products. The products tested were the products without lidocaine, tested with Juvederm's product that had lidocaine. The median duration for each reaction ranged between 1 and 4 days, and of course, bruising was the longest duration for both products. And we measured the intensity of these adverse events, and they were both mild and moderate in intensity for both products. Apart from that, we have done some other clinical studies, and we do post-market surveillance as well, which is very important for us. So we did several clinical studies on biorevitalization done by the key opinion leader, Dr. Marina Landau. And finally, we have our post-market follow-up and pharmacovigilance data. This is extremely important because it allows us every year to go through our audits and to ensure that we have the right certification and that our regulatory pathway is met with flying colors. But it also helps us to understand what is the sentiment of our users who are so important for us. So what we can see here is general satisfaction with our products, likelihood of recommendation, clinical results, overall satisfaction, and of course the safety and performance as well. And you can see between the orange and the turquoise that the majority of the participants expressed a high level of satisfaction with the safety, performance, and reliability. So I want to end there. I think I covered everything. I will open it up now for any questions that you might have.
If anybody has any questions, please just feel free to unmute yourself and ask away. No?
Hello, I'll try.
Hi, David.
Hello,
Hi, David.
Angel and Debbie, good to see you again. I think the issue of lidocaine is a bit of a red herring. We never ever used to have lidocaine in fillers, and very, very few patients come in and say, oh, does your filler have lidocaine? And I don't really think we need to make a big deal of it.
Mm-hmm. Well, I have to say that this is something that's it's specific by market. We have some markets that for which it's extremely important, and this is why we are working on completing our clinical studies to be able to release this full line into the market for those who want both lidocaine and non-lidocaine. So because we want to make sure that the studies are done at a higher level, it will take a little bit of time. And now the MDR regulations are very strict for the better of the market, I think. So it's just a matter of time until we have the full line. But you're right, there are some markets for which it is less important.
Okay, brilliant.
Come on, questions?
Any questions, guys? Is anybody using Juvederm at the moment, perhaps? Is anybody currently using Juvederm in clinic? No?
They're not using Juvederm. Okay.
You can also
got one.
Yeah. And by the way, you're also, if you think about anything and you would prefer to ask personally, so you can send us your questions afterwards, and we're happy to share, any information, the scientific posters, as I said, the articles. So we're here for you afterwards as well.
So I can see Caroline's put her thumb up for using Juvederm. So great, Caroline. This might be something for you to have a look at in a bit more depth, because the cost comparisons for you and the savings that you could have. And you're using RadiaNt.
Yeah.
Yes. Okay, brilliant.
Lovely.
So mixture, and this is what we're finding with a lot of clinics, is actually they are using a mixture of brands, which is fine, because I find personally going into clinics, what you do find is they're very much led by what the patients are asking for. And of course, a lot of the time where that stems from is high-end marketing. And I know you've spoken about before, Debbie, where your focus as a company is more to kind of invest in the research side of things rather than marketing. So it might not be as well marketed, for example, as Juvederm, but we still get in very similar results at a, you know, like you say, you can pass that cost effect on to the clinics as well as the patients, because you can make it more accessible with it being more cost effective. So just to see, Karen,
yeah, so Caroline, I'm the same as you. I'm very impressed as well with the longevity. I love the results, and I also love the fact that we don't get that huge swelling afterwards. So I find as an injector, it's lovely to certainly doing lips. You're not chasing swelling constantly, which is something we battle with. So, and I have no issue either. The lignocaine is no issue for me either. I think, you know.
Okay, I'm
I don't
just
think something people ask for, or, you know, don't ask for, as David said. I think they just trust you to treat them and
I think that's what we've got to think about. You know, when I was just talking about patients coming in and requesting, oh, I want this filler, or I want this meter, or I want this product. I think a lot of the times you forget that we're the professionals, and we actually, you know, they're coming to us. It's our advice based on the experience that we have and the products that we're using. So, and that's just what's so great about RadiaNt, is that it has all of that scientific data to back it up. And I think that's what's really important when you're treating a patient, especially with it being an invasive treatment. I'm just going to actually reclaim host, Debbie, and I'm just going to bring up our training and offer for the webinar. So just bear with me, everyone.
Before you do, can I just make a comment?
Yeah, of course you can.
Please, Angel. I think the other thing which we should not overlook with DKL and RadiaNt is this is a private company owned and run by medical professionals who are passionate about their business. And this is their business. If it fails, they fail. If people don't like it, they don't sell. And I've been involved in this business for 25 years, and all the brands I've been involved with have started off as small, the Americans call it a mama and papa store, as a small, passionate business. And the best times have always been when it's been a small, passionate business, because the majority of our customers are small, passionate businesses. They're owned and run by a doctor, a nurse, or whatever. And DKL speak our language. They understand what small clinics are going through, and they care a great deal about the results that you get and the customer service. So to cut that down to a sentence, what you get with RadiaNt is very, very hands-on, intimate, honest customer service. And I'm afraid the big brands now, which have all been absorbed into huge corporations, very often run by venture capitalists, it's just a money game. They're just doing numbers.
Yeah.
There endeth the lesson.
Thank you, David. There's a request for the scientific papers, so thank you, Ru. Yeah, we're happy to share that, all of that.
Yeah. Could I just ask Penny, just out of interest, what profession are you? Because we support all professionals. So what profession are you yourself, saying that Juvederm don't support? I always find this very interesting. You still there, Penny? Don't know if she's coming back to us.
No.
Yes, sorry, I'm not very good at the technology of this. I just found over the years, I've been practicing for about 14 years, and unless they've changed, they were never supportive in training, in giving advice, and so I always feel open to companies that want to support people that work on their own rather than in the big clinics. with the mega bucks going through each week or each month. So
yeah, I totally agree with you, Penny, and I think that goes through. I mean, we've all trained with big trainers where you're quite often it is Juvederm, and it is
yeah,
because they're sponsored rather than actually they truly believe in the product.
Yeah.
I know myself as a trainer and have a training academy. I actually work very closely with Alison, who's asking the questions. So I'm loving that she's answering the question, asking the questions for us. And we're both very much of the same ilk, that we support everybody, but we use in clinic what we feel is right. And that's why we pick this brand, you know, because we're there to support you 24/7. So thank you for sharing that. I find it very interesting.
yeah, no, thank you. It's refreshing, really. It's refreshing to hear, you know, what's going on with you. That's brilliant, and I wish you good luck. It's great.
Thank you so much, and we hope you try the product and love it as much as we do.
Yeah, I've been out for a little while through ill health, but I'm bouncing back now. So you know, paying attention to everything that's going on.
Fabulous. Well, let's see you at one of the training days. I'd love to meet you in person. That'd be marvellous.
Smashing. Thank you.
Thank you.
So guys, as we were just talking about training as well, it kind of stems really nicely into what we're going to be offering. So as a company, we 100% support our clients with customer service, training as well. I think we find it really important that actually it's not just about throwing a product at you and letting you go off into the big wide world and trying to, you know, market it yourself and get clients in. We support you as a rounded package. So, you know, we offer training. We offer something called a client marketing drive, which should be up and running from January, where you get access to things like befores and afters, marketing material, the scientific studies, anything that we have resource-wise will be in these folders under brands that you can access, which is great for things like social media. You can use it for things like that. Now, Rue is going to be heading up the training for us, and we have already got some dates for London. She will also be looking at dates for Glasgow and Sheffield. So if anybody is based in those locations, and you want to talk about dates with us that are more suitable for you, you know, we're happy to run these on minimum of 2 people. So if you and a colleague want to come along, etc. Rue was going to talk a little bit more about the training in depth in a minute, but just to go through what we're offering for the actual webinar. So with the filler training, for us, it's really important that you get trained correctly and also that you earn back your investment. So what we look at doing is, as part of your starter pack, essentially, that what you buy, you get your training free. So you get any mixture of any of the derma fillers that you want. And I think even if you've worked out the most expensive, it'd be maximum spend would be $650 plus that. You can get your free derma filler training either in London, Glasgow, or Sheffield. We're also going to include a free 250 ml Mediclor spray, a free Oxygenetics Hydro Matrix, which is a cream that you would put on post-service, and of course CPD accreditation and certification for the day as well. If you guys are already using fillers and are just looking to either switch or add another brand into your clinic, we have got this amazing offer where you can buy 5 and get 1 free. And the code is down there. So we will send you the recording, but if you want to take a screenshot or anything, you would need to put 6 into your basket and then use the code to check out. And all of these are available. The training is available for infinite time. And obviously with the webinar discount, that's available for 1 week. So if you are looking at switching over, it's a very good time to be doing so. I'm just going to pass it back over to Rue. So I'm going to stop sharing and just give it back to Rue so she can talk through a little bit about the training. And if anybody's got any questions about training, she can help you as well.
Thanks, Angel. So, you know, for us, we've talked about this a lot and decided, you know, this was the best package. So if you do just want to attend training and don't want to buy filler, please get in contact with us. We're very open to discuss that, and Angel can discuss the price we've discussed for you just to attend a training day. For me personally, as a clinician, I want to try a product. I want to feel a product and go away. So we thought a good way is, if you invest in the product, we will give you the training for free. It will be small numbers, because for me, it's really important in my own training as well. You will get access to an online training portal where there'll all be the theory and how to best use the product. And then we envisage on training day, it is an injecting day. So either you can have treatment yourself if there's an area you want, or you can bring a model. And we are looking at doing sort of full face rejuvenation. So you'll probably be using maybe 5 ml of that filler you've bought, and then there'll be enough left over for you to go away, do maybe another full face, and that's when you get return on investment. I can't say what you charge in your clinic, but for me, I charge between 160 and 250 a ml, depending on where I'm placing the filler and what treatment I'm doing. So quite quickly you can get return on investment because it's so cost effective to buy in the first place. Training's very, relaxed. We like you to just get the best experience you can out of it. And as Angel said, there will be a drive there with everything on you need, the studies, before and after pictures, things you can use on social media, or the official photographer. And of course, we'll do filming for you on the day using the products. So you get your own filming done to take away and use on your socials. So no, absolutely. Small numbers is a must, and just on as much hands-on. We will be doing needle and cannula. So again, if you're not cannula trained, please let us know, because we're more than willing to do half a day with you to get you cannula trained and get you really confident using that cannula in every area of the face. So we can also offer that as well. Part of this is it's fairly new for us, is you tell us what you want. And I'm happy to come in clinic as well if there's 2 of you in clinic or more, if you're in a small clinic, or you've got a friend that you like to go to training with. I pretty much travel up and down the country anyway. So anywhere between Glasgow, Sheffield, London, if you're on that route, give us a shout and I'm willing to come in. So we have discussed, again, if there's 2 or more, I will come to you in clinic and you can get your own clients in. And, if you wanted to get 2 or 3 clients in and do different areas of the face or even the lips or whatever, we can do it. We can just make it very bespoke to you and what you want to get out of that day. If you want more practice with cannula, we do cannula. So we just want to work with you and give you the experience that you would like. And certainly I can 100% guarantee you will be supported throughout your journey.
Brilliant.
Right.
Thank you so much, Rue. So I think that's the end of our webinar. Has anybody got any questions around the training and what we're offering? I mean, you can always contact us. We'll be in touch afterwards. But you can ask any questions out now, or you can get in touch with us. I'll happily set up a little 15-minute discovery call with you and go through things in more detail. Interested in training, is this one day?
Yeah, it'll be a day's training.
Okay,
and it will be somebody at Alison, thank you for reminding me, it will be very much hands-on. So either you can practice on each other. It's always good to get a bit of free filler. I'm dying to have my marionettes done. So if anybody wants to do my marionettes, I'm there, I'll be on that couch. Or you can provide a model if you wish. And, your model can come in and then you could maybe see them through on a journey. We could maybe do one area, upper face, and you could continue on with lower face. So.
Tanya, where are you based? Devon. So we've got a couple of dates for London already. So I'll send you over some information about that after the webinar, as will I to everybody, so you've all got the details. And again, I think it's really important that we understand what we're trying to do as a company here. It's not really about us making money out of the training itself. We want to educate you on the products correctly and go on this journey with you, because if we give you the right information in the beginning and support you and nurture you, then your business will grow. And in a reflection of that, you'll be coming back and buying consumables from us. And that's the long term about working together. And there's loads of other things that we'll be doing training wise as well. So it's not just around the fillers, and there's loads of different treatments that we can combine. I know we was talking about some peels and stuff that we can do as well. So definitely, keep in touch with us. We will get in touch with you tomorrow with some more information, and also we'll send you a recording of the webinar so that you can go back, and if you've got any questions, again, please just ask us. David, did you want to say anything before we close down?
Yeah, I do. Just a couple of things. First of all, when someone comes from Devon, you say, "Oh, Devon." not like it's an apology. It's a fabulous county, and it's not all that far away from civilization. So let's welcome them, enhance them. But can I say, firstly, Debbie, thank you so much for joining us once again from all the way from Israel. It's quite late in the evening for you. We really appreciate the time you put into this and the help that you give us. Rue, as always, lovely to see you again, and thank you so much for your contribution. And of course, Angel, for putting it all together. Jolly well done. I hope everyone found it worthwhile, and Angel, no doubt you'll follow up, and we'll see lots of new RadiaNt users coming through.
Thank
Yes,
you, everybody.
brilliant. Thank you, everyone.
Yeah, and for the audience, you were great.
So it's goodbye from me.